For almost 7 decades, Amref Health Africa has soared in its mission to provide mobile health services to the most vulnerable and far-flung communities in Africa. Initially focused on providing medical training and emergency airborne surgical interventions, Amref Health Africa's mission quickly expanded. Now the institution stands as a thought leader for global health in Africa, delivering 193 initiatives across 42 countries aimed at improving healthcare access and creating lasting health change in Africa. As African countries progress towards universal health coverage by 2030, our aim is to help deliver tailored healthcare interventions that work for our communities. From project design and delivery and building partnerships with policymakers in the region, we are at the forefront of addressing critical public health challenges across the African continent. We do this by implementing a wide range of programs to address the diverse needs and contexts within the African communities. By placing communities at the heart of our decision-making processes, we ensure that local voices are heard and valued, driving the development of solutions that are not only for our people, but by our people.
Investing in healthcare is critically important across the world, but very specifically in Africa. If I was to reflect on what this means, if you look at Africa's agenda, Africa has an agenda of Agenda 2063, which is about a prosperous, peaceful, and secure continent. But prosperity is a combination of healthy populations, because it's only healthy children who learn, and it's only healthy adults who earn.
Amref Health Africa has been instrumental in convening policymakers and advocating for equitable legislation across Africa, particularly in the realms of universal health coverage, the climate crisis, health security, and Africa's growing youth population, among others. Working with African governments in response to the COVID-19 pandemic, we engaged policymakers to shape evidence-based strategies and guidelines, leveraging our expertise in community health. We have been a steadfast ally to communities in times of crisis and disaster, working with a deep understanding of the diverse needs and contexts within African communities.
When I was in high school, my dream was to be a nurse. When I was chosen to be a community volunteer, I was very much happy because some of the duties I was dreaming to be done, to do it in future, I'm now doing it.
Working with our extensive partner network, our community-led approach has led to the effective localization of healthcare, leading to sustainable African-led solutions that save lives and livelihoods. From convening one of Africa's largest public health conferences, Africa Health Agenda International Conference, bringing together over 2,400 global health practitioners from across the world, to targeted regional advocacy and strategic on-the-ground interventions, we understand the value of localized efforts bolstered by international support. Amref Health Africa continues to work tirelessly to improve the health and well-being of at least 30 million Africans annually, leveraging the vast expertise of our staff, comprising of more than 2,400 people across over 42 countries, to ensure that healthcare is equitable, culturally sensitive, and responsive to those who need it most. Amref, delivering lasting health change in Africa.